So before we talk about how tension releaser works, I just want to talk about what causes tension headaches. Tension headaches are actually caused by tight muscles in the back of your neck, the suboccipital muscles. What happens is we have several vessels that wrap around our head that penetrate through those muscles. So if you have a muscle right here, you actually have arteries and nerves that penetrate through those. So when that muscle gets tight, it squeezes on those vessels. The different vessels could be arteries, veins, lymph nodes or lymph vessels, and nerves, right? So if those muscles get tight, you'll feel the effects downstream, right? Because if you're restricting blood flow here, you'll feel the lack of blood or oxygen will be felt over here around the temple or behind your eye. Or if you're pinching a nerve in that muscle, you'll feel the pain downstream. It'll send messages to your brain saying, hey, there's pain over here, even though the problem is back here. So tension releaser helps relax those muscles to take the pressure off those vessels by applying a very deep and aggressive, basically a deep tissue massage. As a chiropractor, deep tissue massage was the one therapy that made all the difference when treating tension headache patients. Of all the therapies that I performed on my patients, that was like the only thing that made a difference, even more than the chiropractic adjustment. And so basically what I would do, I would just take my two fingers and dig them deep into those suboccipital muscles and hold it for about a minute. And after a minute or two, it would help relieve the headache. Now, during the treatment, it's not very comfortable. It's painful. It's very aggressive. But my patients describe it as a good hurt. It's a therapeutic hurt. It kind of hurts because you're basically applying pressure on those arteries and nerves and potentially aggravating the headache in the moment. But once you take the pressure off and the muscle has released and relaxed and has taken the pressure off those vessels, then it restores blood flow, restores lymph flow and nerve conduction, and things tend to kind of regulate. And so tension releaser does just that, right? These two knobs here mimic my two fingers, and you can adjust them side to side. You can remove them, and you can move them side to side to fit your specific neck size. And you lay on it here to prevent any rocking or sliding back and forth. That's one of our big differentiators between us and other competitors, is that if you look at other suboccipital release products, they'll rock or slide out of place. Ours stays put and is adjustable. And if the two knobs are too uncomfortable or it's too aggressive, you can add these knobs that come with it, and that'll help dissipate the pressure to give you a more comfortable setting. So that's how tension releaser works. Again, it's not the most comfortable treatment in the moment for those 2 minutes that you're doing it, but it hurts, but it's a good hurt. It's very therapeutic, but we are confident that this is what's going to help with tension headaches because I've seen it in my own clinic. This was the technique or the therapy that made all the difference, more than aromatherapy, more than the stretching, more than the chiropractic adjustment or exercises. It was the suboccipital release technique. You can actually look it up online, suboccipital release technique. That's what works for tension headaches. Now you can do it in the comfort of your own home. So hope to hear if you guys have any questions, let us know. Thanks.